what they do.
If and when it does, or if, let's say, worst case scenario, in X number of years' time, they would have to have that replaced because whatever, they've been overly active. Is that an easy operation, not easy operation in the hip, or?
In general, hip revision surgery in general, or specifically after anterior approach hip replacement?
Yeah, either or both. Yeah. Both.
I don't think that anterior approach replacement makes any difference to the technical difficulties of revision surgery. Whether you reuse the anterior approach, you can do revision surgery through the anterior approach if it's been done by anterior approach for the primary hip replacement, or you can choose to use a posterior approach if your preference is a posterior approach. It makes no difference to the complexity of surgery. Hip revision surgery has come along in huge leaps and bounds in the last 20 years. The techniques for reconstructing bone defects, again, it's bone loss that can often be the issue. Reconstructing even massive bone defects has become easier and easier with the introduction of more interesting technology, especially on the socket side. Where you get bone loss inside the pelvis, where traditionally a lot of surgeons would battle for a long time to bone graft defects, fitting wire cages around the defective area and then packing fragments of bone graft into the area, then waiting for several months for that bone graft to incorporate. Nowadays, we often use metallic augments to help with the reconstruction. Great metal that's been discovered to work very well in orthopedic surgery called trabecular metal. It's a tantalum. It's an element called tantalum, which you can make into a honeycomb structure of any shape and size that you wish. It has many of the characteristics of normal cancellous bone, and you can use that to rebuild often very large defects within the bone. So yeah, very different for the surgeon nowadays compared to maybe 20 years ago. Most patients won't have such a complex problem that it isn't feasible to rebuild their failed hip replacement.
Yeah, fascinating. Excellent. Amazing. Wow, that's but I learn even more stuff every time I talk to you guys. I learn a little chunk of it, something extra. So it's really good.